So thank you very much for joining us. Perhaps we can start by saying yesterday marked 1 year in post for you.
Yeah.
12 months in, what are your reflections from what you've seen in health and care services? How far do you think there is to go in terms of compassionate and inclusive leadership?
Oh, wow. How long have we got? Well, the first thing I'd say is it's absolutely brilliant that this conference is happening. I identified quite early on that strength of leadership, by which I mean at all levels, is mission critical to the future of the NHS. In an organisation as big as the NHS, with its 1.3 million employees, and the broader social care system, frankly, I was astonished at how little attention there was to the development of leadership. Yeah. It was essentially felt like it was the sort of thing some people could do, and that it was innate to some people, and not to others, and actually people got promoted whether or not it was innate to them. But leadership can be taught and developed and coached and mentored, and every other very large organisation has a whole programme in place to do this. The biggest organisation that I'd been responsible for running before the NHS was the civil service. 400,000 people rather than 1.3 million, and in a way simpler reporting lines and hierarchies, and didn't have the great complexity that's introduced by the clinician non-clinician split, which is there in all health systems across the world. It introduces complexity because there are clinicians who have no leadership and management experience, who are brilliant at their particular clinical specialty, but regard themselves as an important voice in the leadership of an organisation, and don't regard the need for training and capability building in the leadership space as important. Not many, but there is that challenge. The best leaders often, not always, often are clinicians who are also leaders. Fantastic, more of those please. And by clinician I mean that in the broadest senses as well, doctors, nurses, other health professionals. And if you're a non-clinician, you need to have enough clinical understanding to get the confidence of your clinical staff. And if you are a clinician, the reverse is also true and very, very important. Just because you're really, really good at performing a heart operation doesn't mean you understand how to operate a balance sheet. And sometimes this is missed. So health organisations are really hard to lead because of the clinician non-clinician split. And that, ironically, in the NHS, my sense was, and this is obviously a huge generalisation, was that had led to people ducking the problem of training for leadership rather than throwing themselves into it. And I think, so over the last, it had started already, of course, but over the last year we've put this far higher up the agenda. Dido Harding has done a brilliant, brilliant job at leading this at NHSI as well. And it's a subject that will require permanent and constant improvement.
Thank you. I mean, I think the fact that it's coming to the top of the national agenda is very welcome by colleagues in the audience and well beyond. But often leaders report a disconnect between the rhetoric around compassionate and inclusive leadership that can be written into policy documents and their experience of top-down control from the centre. Yeah. So what do you think your role as ministers, department and arm's length bodies is in creating and role modelling?
Well, this is a perfectly reasonable criticism, and all the comments I make about this agenda are an attempt at leadership from the Office of Secretary of State. And my critiques I think are valid in large parts of the central organisation of the NHS as well as individual trusts. Now, having said that, one of the other parts of good leadership is that you find the really good examples and you celebrate them and promote them. And my God, there are some brilliant organisations across the NHS, and I hope everybody's thinking of one now.
And social care.
And social care, absolutely, very, very important. For instance, I think Amanda Pritchard has been a formidable leader at Guy's and Tommy's, so much so that we have now requisitioned her into leadership of NHSI, and she'll be the number 2 at NHSE at the same time, helping to merge those two. Partly that choice was because she gets this agenda. And she understands the need for those organisations also to represent what is good in high quality, modern, progressive, compassionate, empathetic, team-based, inclusive leadership. I've just rolled out a load of buzzwords, but they're important, right? They're important, because if that's not what you're getting from this relationship, then it's not your problem. Well, it may well be it's not just your problem, it's the problem of the organisation that's giving you poor leadership.
Thank you. You're the Secretary of State for Social Care as well as the NHS. That sector is facing a similar workforce crisis to the NHS, with over 100,000 posts lying vacant. What should the government do about the social care workforce at a time when it's particularly focusing on the NHS workforce?
Well, we focus on the workforce availability as a whole. There's of course, we're not the direct employers in social care, and that leads to a different relationship. And but the total availability in the country of people to do these jobs is absolutely mission critical to success. But in a way, sometimes the focus, I think, my reading of the history, the focus in the past on numbers, which is important, has got us away from the focus on culture and capability of organisations.
Yeah, we need to do both.
The people plan, the interim people plan, was all about how we make the NHS the best place in the world to work, which it ought to be, and has this amazing mission. In fact, I saw on the slides, a team has a defined boundary. Well, I agree, this is more like, it's less like full-blown teams, it's more like the broader team that has a diffuse boundary, but absolutely the shared mission is important, and shared mission across health and social care. So yes, we're tackling the numbers both in social care and in the NHS, but let's not lose sight of the fact that tackling the numbers is only one part of the problem, and indeed the two are intertwined, because if we make the NHS a better place to work, then we improve retention, and that helps with the numbers as well.
And obviously today's conference is all about compassion and inclusion in action, so
Absolutely,
working on the culture. You make no secret of your passion for technology.
Yeah.
What can leaders in health and social care do to create a more tech-ready workforce?
Yeah. So the thing about technology is that actually, well, why do I care about technology? I care about technology because I care about people, and people getting the best possible service, and it being really great to work inside the NHS, which at the moment technology causes huge frustrations to people. And again, in the debate, there's sometimes a bifurcation between people saying, well, you care about technology, therefore you can't care about people. It's literally the opposite way around. In fact, this morning, you might have seen we launched a collaboration with Alexa, so that people who, when they ask Alexa about a medical condition, they're going to get NHS advice. I think it's absolutely terrific, because at the moment they're asking Alexa about stuff anyway, so why not get them the best advice? And on Twitter, I had somebody who's a constant irritating thorn in my side, whose name will not be mentioned, say, oh, this is outrageous, there you go again. What about the shortage of GPs? Well, what about we use technology as well as hiring more GPs? We've got rising numbers of GPs, we've got record numbers in training. Good, need to do more on that. But by God, we can use technology to make sure people get a better service as well. This is not an either or. Yeah. And the truth is that for delivery of good technology, that is all about leadership as well. It's all about people. It's about having people at the top of NHS trusts who get that technology will give back the gift of time to their clinicians and save lives for their and improve the lives of their patients, and are prepared to go through what is essentially a change management process. Adopting technology, the technology is the easy bit. It's like 10% of the problem is the actual technology, and most of it is available, and most of it we use at home already. And Alexa is a sort of extreme example of that. 90% of this is culture change, and it's encouraging people to embrace technology. I hope that my friends at West Suffolk Hospital, my local hospital, won't mind me saying this, but they're one of the most tech-advanced places in the country. They've also got some of the best leadership in the country, and they are best on the Friends and Family test in the country for a mid-size DGH. They've just removed over from bleeps to a smartphone-based solution for internal communication, except for emergencies. So the bleep is still there for the once or twice a day supercritical, time-critical emergency, but for non-critical, they use the pagers. Their communication has gone up 4 times in the couple of weeks since it was introduced. And I spoke to one of the junior doctors and I said, tell me, what do you think about this technology? She said, well, to tell you the honest truth, I thought it was going to be a real pain in the neck. New technology in the NHS has always been a total time sink when it arrives. But it's been brilliant. And of course, changing technology requires to bring people with us, and people are suspicious about it. Of course, that, especially after the experience with technology in the NHS over the last decade.
Yeah.
And it requires leadership to use the best technology that's available.